question I have is, it's not just St. Mary's, but it's every school within the Archdiocese of Boston. I mean, we're talking about 31,000 students.
Well, plus the other archdioceses, there's about 46,000 kids all in around the state.
What is the example of that reality?
I think the biggest example is, first of all, these schools have been open since August in person. They've done a terrific job of using all the mitigation strategies and the guidance that have been developed over the course of the summer and into the fall. And the kids are more than willing to do what it takes to make it work. And that's not just true of the kids in the parochial schools. One of the things the Lieutenant Governor and I have heard from all the kids we've talked to in public schools is, you know, I'll do anything to be able to make sure I go to school. If you're telling me I got to wear a mask every day and love it, I'll wear it. If you tell me I got to sit, you know, a certain distance apart from my classmates, I'll do it. Kids are absolutely fired up about the possibility and the opportunity to be in person. And I think the other thing I would just say is the work that's been done by so many of the schools, public, private, and parochial that have been open, is a real sort of laboratory for everybody else. And I certainly hope that many of the lessons that have been learned over the course of the first sort of 2/3 of this school year can be incorporated by others as well. I love it. Cafeteria this today is serving. Yeah.
Do you think you can meet Joe Biden's deadline of May 1st that he proposed last night?
Yeah, so, I mean, no matter how you do the math, we're one of the top vaccinators as a state in the country. And within a matter of days, every dose we get from the feds ends up in somebody's arm. And if the feds can actually deliver on the vaccine supply issue that we've all been talking about, and the message we keep getting is we're just a couple of weeks away from being to the point where you're going to have more supply than you know what to do with, I think getting to the president's objective is absolutely doable. But it's going to require a significant increase in available supply to be able to deliver that kind of volume over a reasonably short period of time. But I can tell you this, everybody would love to be able, I would love to have the problem of having so much supply I can't figure out what to do with it. That's not the problem we have. We have capacity to deliver 3 times the amount of supply we get. So if they really do deliver at the end of March, the beginning of April, the middle of April, the kinds of numbers that people have projected they may be able to deliver, then I think the president's objectives are absolutely achievable.
Governor, is there a disconnect between what the president was saying last night and that it sounds like the vaccines are almost here, but you're telling us every week we're not getting any more, we're not getting any more. We're in light of the
Well, obviously the folks in D.C. know a lot more about what's in the pipeline than we do. I mean, I've said from the beginning that one of the biggest challenges we have, and this isn't just a Massachusetts issue, it's true generally for states, is, you know, we have a week or two for which we can order, and that's about as much window as we get. But they have said several times now that there will be a significant increase in Pfizer and Moderna and in J&J by the end of March. And if they mean significant, and that translates into significant increases in, you know, sort of the early part of April, that could make a big difference. And as I've said several times before, you know, don't underestimate the power of the J&J vaccine to change the game on some of this, because it is a one dose. I mean, if you think about the 250,000 doses that we're doing a week now here in Massachusetts, about 150,000 plus or minus are first doses and another 100,000 are second doses. If we could get to the point where we were doing 250,000 one-time only doses, you know, it dramatically increases how fast you can actually fully vaccinate people. And that, I think, is one of the reasons why so many of us are anxious to see a big J&J supply end up in this mix.
What did you think of the president's comments last night? You watched.
I thought the thing I appreciated the most about the comments was the recognition and appreciation for just how incredibly difficult this year has been for everybody. No matter who you are, where you live, what your circumstance or your situation is, this has been a profoundly challenging time. And I also appreciated the fact that he said, look, we want to get to the point where people can do what we would call the sort of rites and rituals of summer by the 4th of July. And, you know, that's kind of it's a goal, an objective, one everybody can understand. And the thing I think we need most to get there is for that vaccine supply to expand to the point where states like ours, which can do 3 times what we're currently doing, have the ability to just take that supply, distribute it, and give everybody that sense of security that comes with being vaccinated.
And 2 things, bring it back to today. Was there something that stuck out to you from the students, you know, in light of everything you're going through with the teachers union, the back and forth, anything that stuck out to you from what they were saying?
The 2 things, well, first of all, I thought they were incredibly articulate on all the points that they made, but the 2 things the kids said that Lieutenant Governor and I have heard before from kids who are in school is this willingness to do whatever it takes to be safe and to stay in school and to comply with the rules. That message has come through when we've been in elementary schools, when we've been in middle schools, when we've been in high schools. It doesn't matter. Kids will do whatever it takes to be in school because they want to be in school. And, you know, back at the beginning of all this, one of the questions people had was, will kids comply with wearing a mask? Will kids be willing to socially distance? Will kids be willing to do all these things? And the answer overwhelmingly is yes, because they want to be here. And the second thing was several of them spoke about the difficulties they had in a fully remote environment, getting what they needed to get out of their educational experience. And that's also quite consistent with what we've heard from kids in other schools as well.
And about the pre-registration program that's out, so for the people who pre-registered today, when is the soonest people will start to get notified for an appointment?
The 16th. The 2 things I'd say about this, first of all, I think we're up to about 200,000 people who've pre-registered at this point, which is great. People will start getting noticed on the 16th for open appointments, and if you aren't eligible, and if you're not currently eligible and you sign up, what will end up happening is you'll end up in the pool whenever your eligibility begins. So if your eligibility begins on, for the sake of argument, April 10th, you will be in the pool with everybody else who registers on April 10th. You're not going to get ahead of that because that wouldn't be fair to all the people who showed up on the first day of eligibility. But you will be in that pool for whatever the first day is.
Governor, are there any plans to kind of ramp up vaccination in the communities that have been hit the hardest by the virus?
So one of the things, we've done a number of things with respect to that. We talked a little bit about this yesterday when we were over at the Reggie Lewis Center in Roxbury. We are continuing to expand support for Reggie Lewis, which is a really important asset in Boston, but also working with the 20 most disproportionately hit communities with their local community health centers, with some of their faith-based organizations and some of their community-based organizations to basically create both messaging and points of access to get vaccines in those communities. And we also have a contract with 2 organizations that are pretty good at this stuff, Archipelago Strategies and Healthcare for All, where we're literally going to engage in sort of the equivalent of a campaign. And one of the things we want to see those folks do is work with local organizations and local community leaders to knock on somewhere between 500,000 and 1 million doors, and to make sure that we deliver a message to folks through those organizations and those individuals about the importance of getting vaccinated, why it's safe and important for people to get vaccinated, and then creating kind of a cookbook around what things we're going to have to do to help those folks get vaccinated. If they can't go, how are we going to bring the vaccination to them? The other thing about J&J, and Steve's heard me talk about this part before, the J&J vaccine doesn't require a deep freeze. You don't have to thaw it out the night before. There are so many less complicated issues around preparation associated with it, and you don't need 2 doses. So with that vaccine, you could actually go to a senior center and just vaccinate as many people as you can vaccinate there, or a community center and just vaccinate as many people as you can there, and it's a one-shot vaccination, so you don't have to go through the effort of then figuring out how you're going to reconnect with these people in 3 or 4 weeks, because you're done. And I think that has tremendous potential to put a really big mobile presence in a lot of these disproportionately affected communities.
Last question.
Governor, there'll be people who see this today and say, you're here at a parochial school which can have smaller class size, smaller enrollment, and yet we see the success. How does this transfer as we get more kids in the public schools back to in-person learning, knowing that the size of classes and the population is certainly going to be larger?
Well, a couple things. One is we were in Gloucester about a week ago. They've been in school for 101 days in a row. And in fact, the day we went there, they were celebrating 101 Dalmatians because they've been in school for 101 days. So there was a lot of black and white, polka dots all over the building. And they had done some very clever things to figure out how to make the school day work for them. And we've been in other schools, in other school systems, public school systems, where people have figured it out. And in every district, it's going to be a little different. And what we've tried to do is make things available to support schools that choose to go here. For example, we now have about half the districts in Massachusetts are using a weekly testing surveillance program that we developed. It's pretty easy to use. And if every school district wants to use it as part of a reopening strategy, happy to have them do it. We've also spent 10 months working with scientists and researchers and clinicians to do a study on whether there's a difference in infection rates between 3 feet of distance and 6 feet of difference. And the answer is there isn't. We've also had tons of practical experience in the schools that have been open, private, public, and parochial, around mitigation strategies generally and what works and what doesn't. And the infection rates in these schools have been incredibly low. And in addition to that, you also have all the guidance that's been put out by the American Academy of Pediatrics and why it's important for kids to be in school, and a pretty decent set of tools in the toolbox that they've developed for people as well. There's a lot of practical experience now that people have had in a variety of different settings that didn't exist back in August when people were trying to make these decisions. And the final thing I'll say is, in January we had about 266 communities in Massachusetts that were high-risk communities. Now we have 14. I mean, the progress the state's made with respect to reducing just the presence generally of COVID in the environment as we've ramped up vaccinations has been extraordinary. And I think that will make it easier for people to do this.
Thanks, everybody.
Thanks, folks. Appreciate you coming out early.